Grace, and I'm the scheduling coordinator for NJ4S Union Hub. Today we'll be having our Monday presentation, and today's presentation will be Health Equity, Ensuring Wellness for All by Briana Ampadu. A little bit about her. Briana is a prevention consultant at Prevention Links, where she serves the NJ4S Union Hub. She holds a Bachelor of Science in Public Health and Master of Public Health, both with concentrations in community health education. She's passionate about educating the community on various topics, and she has a particular interest in sex education and is dedicated to advancing the cause of promoting safe and healthy lifestyles. In her free time, she enjoys cooking, photography, and actively participating in community activities. So without further ado, I will hand it over to Brianna for her presentation.
Thank you once again, Grace. Welcome everyone to this presentation for April. Our topic for today is health equity, and we'll be diving into talking about health equity and ensuring wellness for all. Just a brief introduction on what we'll be discussing today. We'll be talking about the importance of ensuring the wellness for all. So health equity is essentially a thriving society. So we look at trying to lower the health disparities in communities, which can lead to economic burdens, reduce productivity, and lower quality of life for marginalized groups. When we think of health equity, we also think of the term equality, and they sound similar, but we'll define both of them later on throughout the presentation. They both deal with fairness and the idea of fairness. So there's a distinct difference between them both. And then some other topics that we'll be touching on today is social determinants of health, healthcare disparities, strategies for promoting health equity, and then the role of policies, community initiatives, and individual advocacy. So the question is, what is health equity? Health equity it means that everyone has access to resources and opportunities to achieve optimal health. So some people and groups face more hardships and adverse circumstances that make it more challenging to achieve goals. So health equity basically helps with the disparities in health outcomes. So often from systematic inequalities, income, education, housing, and healthcare access. And then achieving health equity requires addressing both social and structural barriers to wellness. And what is equality? Equality is the state of being equal. So especially in a status, rights, opportunities, it means ensuring that every individual or group is given the same resources or opportunities without discrimination. So equality overall is the idea that everyone is given the same resources and opportunities to thrive. And when we look at equality and equity, there's a famous picture where this is kind of similar to it, where it's three individuals staring at a baseball game. When it's equality, everyone gets that same stand to be viewing the baseball game, but as you can see, the third person isn't able to see the baseball game because even though equality gives the same opportunity and resources, sometimes those same opportunities and resources aren't meant for everyone. If they're too short, they can't see the game. With that, from that lovely video from the CDC, health equity starts with finding out the social determinants of health in communities. So the social determinants of health are non-medical factors that influence health outcomes and the well-being of individuals in a certain community. So economic stability talks about employment opportunities. Are there enough jobs in this community for residents to be able to afford their rent, for them to afford groceries? Income level, food security, are there enough food shops that they can go to, grocery shops? Is this community in a food desert? Those are some questions that public health professionals and professionals in general would ask themselves when looking at certain communities. The financial stability and access to safe housing, education and access and quality. We look at early childhood education. Are students getting that education they need? Is the town that they're living in able to afford to send their students to school for free? Things like that. The quality of the schools and the accessibility of higher education when these students go from kindergarten all the way to high school. Are they able to get into college with the resources in their communities? Healthcare access and quality, the availability of primary care providers, the affordability of medical treatments, culturally competent healthcare services, which is very important, especially being that most professionals should be culturally competent of the communities that they're in and what they need and resources to actually help them, knowing that some things are just a cultural thing that you just have to understand to lead that individual into a better quality of health. And then neighborhood and built environment. So, is there clean air and water, access to parks and recreational facilities? We'll talk about it a little bit more later on, but some neighborhoods don't actually have the clean air and water. Transportation opportunities, exposure to crime and violence, and then with social and community contexts, support networks. Do they have a support network in their community? Are they able to go to sports and have that support network in their community? Are they able to have friends and have that time to build within their community to have those support networks? Discrimination, community engagement, and then systematic racism. So with that, healthcare disparities are very prevalent in when we in the talk of health equity as well. So the definition of healthcare disparities is differences in health outcomes and healthcare access across various populations. So some examples of these disparities that can be seen in certain communities are higher infant mortality rates among Black and Indigenous populations, disproportionate rates of chronic illnesses like diabetes and hypertension in low income communities, limited healthcare facilities in rural and underserved areas, language barriers, and cultural insensitivity in medical care for non English speakers. And most of this is because one, these communities don't have the access to the healthcare systems, and two, they also just some of them don't have the education background, especially like when we talk about disproportionate rates of chronic illnesses like diabetes and hypertension. Some people in these communities don't know how to eat healthy, or they may not even have the access to eat healthy because if they're making a certain income and that income can afford their rent for that week, then they may be set aside with a lower amount of money to feed themselves. And if they have children or a spouse, they're going to get foods that are one, quicker, and two, less money, and they can afford those meals. And then the impact on health outcomes, increased morbidity and mortality rates. When we think about morbidity, it refers to the state of being diseased or unhealthy within a population. It can also describe the incidence or prevalence of a specific disease or condition. Mortality refers to death, particularly the number of deaths in a population due to a specific cause or over a certain period of time. Higher healthcare costs and overall lower life expectancy for marginalized populations. So briefly before we jump into the strategies to promote health equity, Miss Simmons' story, one thing that really resonated with me is the fact that she was saying that she grew up eating like pork, bacon, pork chops, things like that. But once her daughter like introduced her to healthy eating, that's when she decided to change her habits and actually become educated on healthy eating. Within my own family, diabetes, high blood pressure definitely runs in my family. So growing up, I really watched my parents like actually break that education barrier between their parents and like us. Like they were making sure that we were eating healthy and like healthier foods because in our cultures there's a lot of oils and fried foods and a lot of foods that aren't as healthy. So they really introduced me and my siblings into eating healthier and not even just eating healthier, but being active. They put us into sports. They made sure that we were being active throughout like all of our journeys. Even till today, like my parents still hold me accountable on being active and eating healthy as well. So yeah, with that, some strategies to promote health equity, addressing social determinants of health. This is what I was talking about earlier about how professionals, before they even start to think about how to help a community, they have to address what their social determinants of health are. So ensuring that the economic opportunities are there for residents in the community, quality education, and then stable housing. Improving access to quality health care, so expanding Medicaid, increasing funding for community clinics, and implementing telehealth services. Telehealth services are kind of new, not really, but they became very prominent once COVID came around. So having the access to talk to your healthcare providers through video call, through I know like my healthcare provider can text me through like our app portal too. So things like that, where it's not a dire need to talk to your healthcare professional, but you can do it on the go or if you have that access as well. So enhancing health literacy and education, so providing that cultural tailored health information and promotion prevention care. And this is very important as well because you can't go into certain communities just demanding people to do what you're saying. You have to intertwine with their culture. It's not easy at first, but they need to be able to trust you into leading into the health equity. And then culturally competent healthcare practices, so training medical professionals to understand diverse health needs and eliminate implicit biases. And then the role of policies and health equity. Government policies play a huge role when it comes to health equity. So the expansion of Medicaid and Medicare to cover vulnerable populations, the Affordable Care Act as well, the provisions that ensure insurance coverage regardless of pre-existing conditions, and then public health funding to address health crises affecting marginalized groups. And then workplace and institutional policies, so paid sick leave and workplace wellness programs, and anti-discrimination laws to ensure fair treatment in healthcare settings, and legislation addressing systemic barriers, fair housing policies that reduce exposure to environmental hazards, and then minimum wage increases to promote financial stability. And just bringing it back to the fair housing policies that reduce exposure to environmental hazards. A great example, well, not a great, but an example of this is a Love Canal, which happened in Niagara Falls, New York in the late 70s. It was discovered that these residents were living on top of like toxic hazard dump. So those chemicals were going into the environment. They were drinking it. They were eating them. This was causing a lot of the residents in that area to have like birth defects, they had cancer and other illnesses because of the fact that this wasn't being addressed in their community. Community initiatives for health equity, grassroots movements, so community-driven programs addressing local health disparities, community health centers and free clinics providing accessible healthcare services regardless of income or insurance status, um, public pub, public/private partnerships, collaboration between healthcare providers and businesses and local governments to create sustainable solutions. I know there's a few like mobile clinics in New Jersey that go around to communities to test for cancer. So that's very good because I think those mobile clinics are under RWJ if I'm not mistaken, and they just go around to communities to test them for cancer. Health environments, so initiatives promoting clean air, safe drinking water, green spaces, and access to healthy foods. There is Healthy People 2030, but New Jersey also has their own version that was modeled after the Healthy People 2030. So it's Healthy New Jersey 2030, and it focuses on four core topics. Which is access to quality care, healthy communities, healthy families, and healthy living. So it's all about learning about these communities and making sure that they learn about what resources they have and how they can help not only themselves but other people in their community. And I know with one of the programs we do here at NJ4S, which is Strengthening Families, one of the main things that it is promoting is that healthy family meals. So, teaching families different types of meals that they can eat and doing it together. And then individual advocacy and action. One of the most important things is educating oneself and others. So, raising awareness about health disparities and their causes. If there's a certain health disparity that you may not have too much of a background on, like taking the time to read about it, taking the time to educate yourself and others to promote that education for all. And then supporting equitable health care policies and organizations, so engaging in advocacy efforts and voting for policies that promote health equity. This looks like being a part of your voting legislations. Like when it comes time to vote, you're voting for your township because the New Jersey or the state legislation is very impactful for health equity and your well-being. And then volunteering and community engagement, participating in local health programs and supporting marginalized communities. Sometimes I take the time to just volunteer at my local food pantry to give back whenever I can. And it doesn't have to look like that, it can be interchangeable, but just taking that time to um, break the barrier for health equity. And then advocating for inclusive healthcare practices, so encouraging healthcare providers to implement equitable care policies and culturally sensitive approaches. Bridging the gap for a healthier future. This looks like call to action. Health equity requires a collective effort from not only individuals, but from communities and policymakers. So taking that time to reach out to your policymakers, knowing who your mayor is, who your governor is, if you have the time to actually email them or even stop by to talk to them about certain things that you feel as though may be affecting the community. The importance of sustainable change. So implementing long-term strategies to eliminate health disparities, which the Healthy New Jersey 2030 is doing a great job at doing that as well. Then building a just healthcare system, so ensuring equitable access to resources, addressing systemic biases, and fostering community resilience. And with that, I just want to leave everyone with this quote from Dr. Martin Luther King Jr., which is, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." Dr. King believed that everyone deserves a chance to be healthy, and he saw that many people, especially in poor or minority communities, were falling behind in healthcare. So just thinking about what you can do today to help others and to just decrease um, the health equity or health disparities in certain communities. So thank you so much.
Thank you so much, everyone, for joining us for that amazing presentation. And thank you so much, Brianna. That was very informative. If you enjoyed the presentation and you want to keep up with what NJ4S Union Hub is doing for our community, you can follow us on our social media. It's at NJ, the number 4S Union. Or if you have any questions about our programming, you can email us at NJ, the number 4S Union at preventionlinks.org. Thank you again for joining us and have a great rest of your day.